Hello, my name is Adolfo Ascencio, and today I'll be doing my presentation on levetiracetam, also known as Keppra. So, for some background on this medication, seizures and epilepsy are very heterogeneous, so they have to be classified because of that. The International League Against Epilepsy in 1981 divides seizures into those that are partial and then those that are generalized. Levetiracetam is a drug within the pyrodoline class that is used to treat various types of seizures stemming from epileptic disorders. It was first approved for use in the U.S. in 1989 and is structurally unrelated to other anti-epileptic drugs, also known as AEDs. Levetiracetam does possess a wide therapeutic index for its use. For its pharmacokinetics, its absorption in Tmax is approximately 1.3 hours after dosing. Its concentration max is about 31 micrograms per milliliter following a single 1 gram dose, and then it was 43 nanograms per milliliter following a repeated dosing. For its distribution, less than 10% is protein bound. A volume of distribution is 0.5 to 0.7 liters per kilogram. Its metabolism is in the liver. Its enzymatic hydrolysis is the primary pathway, and that's where 24% of this drug, 34% of the levetiracetam dose is metabolized, and 66 is excreted in the urine unmetabolized. For its excretion, as mentioned earlier, it's renal excretion, and 66 of it is unchanged or unmetabolized. Its renal clearance is 0.6 milliliters per minute per kilogram. Its total clearance is 0.96 milliliters per minute per kilogram, and it has a half-life of 6 to 8 hours. For its mechanism of action, levetiracetam's binding to the synaptic vesicle protein 2A, which also known as the SV2A, is a key driver of this action. The SV2A is a membrane-bound protein that is found on synaptic vesicles and is ubiquitous throughout the central nervous system. It appears to play a role in vesicle exocytosis and in the modulation of synaptic transmission by increasing the available amount of secretory vesicles available for this neurotransmission. Stimulation of the presynaptic SV2A by levetiracetam may inhibit neurotransmitter release, but this action does not appear to affect normal neurotransmission. This has led to the suggestion that Keppra exclusively modulates the function of the SV2A only under certain pathophysiological conditions, though. Levetiracetam and related analogs show a correlation between the affinity of the SV2A and the anti-epileptic potency, further suggesting that the action at this site contributes to its anti-epileptic activity of this drug. Levetiracetam has also been known to indirectly affect the GABAergic neurotransmission, despite having no direct effect on the GABAergic or the glutamatergic receptors and modulate ionic currents. It has been shown in vitro to inhibit the N-type calcium channels. How or even if these actions are implicated in its anti-epileptic action has yet to be elucidated. Um, this medication's mechanism of action isn't fully understood as to why they are just making suggestions as to what does happen from what we do know about it. For its indications, we have myoclonic seizures in patients 12 years of age and older with juvenile myoclonic epilepsy. We have primary generalized tonic-clonic seizures in patients 6 years of age and older with idiopathic generalized epilepsy and juvenile myoclonic epilepsy. For partial onset seizures, monotherapy or adjunctive therapy, for the ages of 1 month to 6 months, a dosing of 7 mg per kg twice a day, increasing by 7 mg per kg twice a day every 2 weeks is recommended, to a recommended dose of about 21 mg per kg twice a day. For 6 months to less than 4 years old, 10 mg per kg twice a day, increasing by 10 mg per kg twice a day every 2 weeks to a recommended dose of 25 to 25 mg per kilogram twice a day. For the ages of 4 years to 16 years old, the dosing is the exact same with just a slightly higher recommended dose of 30 mg per kilogram twice a day. For adults 16 years and older, instead of going weight-based dosing, we get to the actual calculated dose of 500 milligrams twice a day and increasing it by 500 milligrams twice a day every 2 weeks as a recommended dose of 1500 milligrams twice a day. For myoclonic seizures in adults and pediatric patients 12 years and older is a standard dose of 500 milligrams twice a day, increasing by 500 milligrams twice a day every 2 weeks to a recommended dose of about 1500 milligrams twice a day. Adult patients with impaired renal function, however, is recommended to do a dose adjustment, and we'll go through this on the next slide. So for the renal impairment, depending on the release mechanism of Keppra, as it does come in immediate and extended release, and different brands of it, there are different creatinine clearance renal adjustments that are appropriate for this. So for example, for immediate release and or IV formulations, for having a creatinine clearance greater than 80, no dosage adjustment is required. For a creatinine clearance between 50 to 80, a dose of 500 to 1000 milligrams Q12 is recommended. For creatinine clearance 30 to 50, we do a dose of 250 to 750 milligrams Q12. And creatinine clearance less than 30, we restrict it to 250 to 500 milligrams Q12. And then for dialysis, we do a dose of 500 to 1000 milligrams every day. And then you add a dose between 250 to 500 milligrams as a supplemental dose right after dialysis. And this is just because a lot of the drug is being filtered out through the act of dialysis. So we need to enter the serum back with some Keppra. So for its extended release tablets, so Keppra XR brand, the creatinine clearance greater than 80, once again, no dose adjustment required. For creatinine clearance 50 to 80, a dose of 1000 to 2000 mg Q 24 hours. Creatinine clearance between 30 to 50, do a dose of 500 to 1500 milligrams Q24. Creatinine clearance less than 30, we do a dose of 500 to 1000 mg Q24. For those patients with end-stage renal disease requiring hemodialysis, immediate release formulation is usually recommended. And for the extended release tablets under the brand of Alesia XR, has slightly different monitor for the creatinine clearance, so you dose it slightly different. For the creatinine clearance greater than 80, once again, no dose adjustment is not required, so that's standard. For the creatinine clearance between 50 to 80, you do a dose of 1000 to 2000 mg Q24. For creatinine clearance less than 50 now, though, is not recommended. And then same as the other extended release for those patients who are on end-stage renal disease requiring hemodialysis, immediate release tablets are usually recommended. Now for the dosing for primary generalized tonic-clonic seizures from 6 years to less than 16 years old, we do a weight-based dosing of 10 mg per kg twice a day and increase it in increments of 10 mg per kg twice a day every 2 weeks to a recommended dose of about 30 mg per kg twice a day. For adults 16 years and older, however, we'll do a dose of 500 mg twice a day, increasing by 500 mg twice a day every 2 weeks to a recommended dose of 1500 mg twice a day. For drug interactions, since levetiracetam can cause sedation and CNS depression for the most part, it can enhance the CNS depression effect of alcohol, cannabis, and other drugs such as carbamazepine and opioids. A concurrent prescription with enzyme-inducing anti-epileptic drugs, so this is such as like phenytoin, carbamazepine, which are also drugs that can be used to control seizures. It increases the clearance of levetiracetam by 9 to 22%. Co-administration with enzyme inhibitor drugs, however, such as valproate or Depakote, decreases the clearance of levetiracetam by 18.8%. So it is always important to ask and monitor any other anti-epileptic drugs that the patient may be on, as most of them are either potent inhibitors or potent inducers. So that can definitely interact with the medication, and then we would have to either adjust the dosage accordingly, so that way no toxic effects are due to it, or not enough of the medication is being present in the system to cause its effect. For adverse reactions, cardiovascular reactions can lead to increased diastolic blood pressure in infants and children specifically. For gastrointestinal reactions, usually vomiting, abdominal pain, nausea, or anorexia is expected. For infections, for whatever reason, pharyngitis and rhinitis have been reported in 7% to 15% of all patients on this drug. Some patients do have hypersensitivity reactions to Keppra, so definitely want to watch out for any signs of angioedemas, and any anaphylaxis reaction, toxic epidermal necrolysis, hives, respiratory distress. For hematologic parameters, reactions, leukopenia, eosinophilia, and sometimes rarely pantocytopenia has been reported. For hepatotoxicity, there are some rare cases where the serum enzyme elevations can rise and then have a clinically apparent liver injury. You also want to warn for any signs of serial mental changes. This can lead from signs of confusion, sleepiness, loss of memory, and forgetfulness. For monitoring, it is very important to always get a baseline creatinine, and this should always be checked right before initiating levetiracetam therapy. This will indicate as to whether we have to do any dosage adjustment for the patients to make sure it's not causing any further damage to their kidneys. Clinicians should closely monitor signs for symptoms of depression, suicide, and psychosis. Blood pressure should also be monitored closely, specifically in children less than 4 years old. And then therapeutic drug monitoring may also be recommended in select patient populations as the dosing guide and monitor compliance. And this is usually for those who are like critically ill, who are pregnant, as is not indicated for pregnancy, or people who are pregnant or want to become pregnant. Also, elderly patients fall into this certain selected patient population. Some warnings, not necessarily going from like least prevalent to most prevalent, but definitely want to warn for that suicidal risk or any altered thoughts. So that leads into like the behavior abnormalities, so any confusion, irritability, change in moods, drowsiness and tiredness. This medication does sometimes cause people to become slightly drowsy or sleepy. Serious skin reactions such as SJS usually is a serious side effect of that medication to be monitored and be cautious for. Having low blood cell counts, and then also, as mentioned, the use during pregnancy is not recommended. So some other precautions to just list off. It is important to tell your doctor if the patient plans to become pregnant or is pregnant while using this medication. It can also cause changes in moods or behaviors. Also in like coordination, can also cause unusual tiredness or weakness. This medication does also cause some people to become dizzy and drowsy or less alert than normal. You want to make sure that the patient is not driving or doing anything out of the ordinary until the patient knows how the medication actually affects them. Some people are or tend to be a little bit more sensitive to this medication. So it's always very important to know how the medication will affect that certain individual at the time. As mentioned earlier, also the medicine does also sometimes cause severe allergic reactions. So this can be ranging from the anaphylaxis or angioedema, which is obviously a life-threatening condition. Want to let your doctor know immediately if there's any like hive-like swelling on the face, eyelids, lips, the tongue, throats. Um, Also for that serious skin reaction, when I mentioned earlier that SJS, which is for like stands for Steven Johnson syndrome, it can occur with this medication, so you want to let the doctor know if there's any blistering, peeling, loosening of the skin, specifically is a telltale sign of this condition. And that concludes my presentation. Thank you for listening and your time. These are my references. Thank you so much.